Thank you. As all of you know, the World Health Organization has declared the coronavirus outbreak a global health emergency, and our administration now has declared it a public health emergency. Yet, Secretary Azar, we've talked about this, you've heard about it. The Trump administration asked Congress for just $2.5 billion to combat a disease that the CDC's director, Nancy Messonnier, warned could severely disrupt daily life and could severely and could cause severe illness in the United States. So, in that request, you did not, as I understand, include. We're not specific about surveillance for testing kits that actually work, because not all of them have, and for treatment. Instead, you suggested robbing $500 million from the United States response to Ebola epidemic, which actually still is raging in places. So I find it incomprehensible that you're asking for a molehill when what we really need is a mountain of support here. Secretary Azar, yes or no, do you agree with the President of the United States that the coronavirus is very much under control in the United States, unquote, and will, quote, go away, unquote, by spring?
He did not say the last part that you just said. He said, we hope it will go away with warmer weather. I hope everybody here would hope it would go away with warmer weather. The virus in the United States has been in a contained situation to date, but that can change. As Dr. Messonnier said, we expect more cases, and we expect that we will see at least limited community transmission of the virus in the United States.
Let me ask you another question. My hometown of Chicago reported the first human-to-human transmission of the coronavirus in the United States. And though the Illinois and Cook County and Chicago Departments of Public Health have expertly, I would say, handled over our two coronavirus cases, they have not received any reimbursement or financial assistance for the work they've done. I just met with the Director of Public Health in Chicago, who said they're spending $150,000 per week to respond to this. Will the United States be able, in the $2.5 billion, be able to help local and state health officials who have already spent lots and lots of money trying to deal with this?
So yes, that is actually part of the supplemental request, is to fund state and locals, in addition to the $675 million FEP money they already have received for many years. Illinois, of course, received each year $16.3 million for exactly these activities, but we want to give additional funding through the supplemental request for those activities.
Well, that's really good news. Thank you. Secretary Azar, will your $2.5 billion be enough to help healthcare workers in hospitals and nursing homes, or the home care workers who have to care for quarantined individuals?
In what respect are you asking?
Well, I mean,
salaries, because they're already paid. I'm just curious. I want to.
No, I mean,
if there are elements we need to add to our request, we'll be glad.
There may be a lot of
Congress
additional costs that people that work in hospitals, and they may have to hire more people. Is there any help that's going to be for staffing?
Would you mind if Dr. Kadlik responds?
I can address part of your question, ma'am, and that is $350 million is dedicated for personal protective equipment that could be used by healthcare workers in many different settings. So we have that. We're stockpiling that to make it available should communities need that, in addition to what they have on hand.
Okay. Let me just finally say this. Last week, 45 of my colleagues and I sent a letter to President Trump. And what we were talking about is, are we going to be guaranteed an affordable treatments or vaccines that are developed? We're concerned that private pharmaceutical companies may end up having a role in this and raising the cost beyond the point that people could well afford it.
We absolutely share your passion around ensuring affordable access to medicines, but the private sector must have a role in this. We will not have a vaccine, we will not have therapeutics without the private sector candidates that they and we will have to invest in.
But we have paid for all of the R&D so far, right?
No, that's not accurate. For instance, the Gilead has a product, remdesivir, that was originally NIH-funded basic research, I think, out of University of Alabama, but they've carried forward with development. Moderna is using Dr. Fauci.
My time has expired, but if I could just reaffirm, then you're saying it will for sure be affordable for anyone who needs it.
I'm saying we would want to ensure that we work to make it affordable, but we can't control that price because we need the private sector to invest. The priority is to get vaccines and therapeutics. Price controls won't get us there.
Mr. Secretary, thank you.